Right, it's just going to touch after 7:30. Welcome back to News Feed, the AM edition on Newsroom Africa, channel 405. India is battling a devastating second wave as of the 1st of May 2021. The daily cases reached 400,000. Now, the Asian country has seen a sharp increase in COVID cases from April this year. Many of the cases are attributed to large gatherings. Experts had warned government officials at the beginning of March already that the new coronavirus variant is far more contagious and dangerous. Now, the South African Medical Association has urged the government to respond quickly to the possible local emergence of the new COVID-19 variant recently discovered in India. This follows the arrival of a cargo ship from India that docked at the Durban port this week. 14 crew members aboard the vessel have tested positive for COVID-19. They are now in quarantine. Officials from the National Institute for Communicable Diseases are testing for the strain. To talk to us more about this, we're joined by Professor of Sociology at Wits University, Professor Srila Roy. She has done extensive research in India while staying there. Professor, thank you so much for your time this morning. It's always concerning when we see such high spikes, but India is quite some distance away from South Africa. No direct flights to the country as well. Is this enough cause for us not to be too concerned, or should we be worried?
Hi, morning. Thanks for having me. I think that's a bit curious how the public messaging here keeps saying that there are no direct flights. As far as I know, there haven't been direct flights for a while between the two countries. So when I flew back, which was, it's probably 2 weeks, but it feels like a lifetime ago now. I took a flight via Doha, right, which is often how these flights are directed. And you have to get RT-PCR, the negative test before you board, obviously. And the airline did a very good job of checking that you had those tests. But on landing, I found OR Tambo quite, how shall I put it, not complacent, but quite relaxed about, checking those tests. This is not to say that I think immediately we should lock borders, but I do think there's a lot that you can do in between. I mean, for instance, institute some forms of quarantine. I mean, nobody at the airport told me I should even quarantine at home, which obviously I've done irrespective, right? So I think there are a lot of things that we could do to just ensure what's coming in and what's going out, and if people are okay, frankly.
Now, we know that a lockdown has since been announced, of course, since the COVID-19 fatalities are going even higher and increasing by the day with mortuaries filling up. Give us an actual sense of what's happening on the ground there when you were there and what you found when it comes to the processes and the management of COVID-19. I mean, looking at matters here at home, South Africa has faced a lot of criticism, for instance, on the access processes to vaccines. What did you find in India?
Okay, so just to clarify, there isn't a national lockdown. There are lockdowns in localized areas which have been instituted by the state governments. So there isn't actually a pan-Indian lockdown. But in most places, there are curfews and there are lockdowns. So when I was there and I was in the capital city, Kolkata, of a state called West Bengal, I think it was really emblematic of what was happening and this very poor and confused public messaging. Because on the one hand, there were rising cases elsewhere in the country. That region was not as bad at the time. But at the same time, I could hear constantly the ambulance siren, which was really, very vivid, and it stays with me. At the same time, we could hear election campaigning, because what was happening at the time was a very unusually protracted election process, which was taking place over 8 stages, much of which was done at the behest of the leading party, the BJP, that has been trying to make inroads into this area, into this region where it has historically not had any success. So you could hear, on the one hand, rising cases, panic around COVID, ambulances, even people struggling to get tests. But on the other hand, there was this strange, eerie normalcy where even election, campaigning was going on. And just a final point, I mean, I think what happens with that kind of public messaging is that people, the public generally feels that there isn't a crisis, that everything's normal. So even people I know were saying, well, it's not as bad as last year because there's no lockdown. And actually, by the time I left in that region, every second person was testing positive for COVID-19.
Now, Professor, what informed the Indian government's response to this second wave and the surge thereof? You mentioned the fact that, publicly there was almost no sense of panic or no sense of concern. Why did the Indian government, why was they so lax about their response?
I mean, that's a great question, and that's a question that we're all asking the government of India with very few answers. But basically, the evidence now suggests overwhelmingly that there was. I mean, you said this in your opening too, that they knew there was a second wave coming, right? There was evidence from their own parliamentary committee, a parliamentary standing committee on, I think, family and health, as far back as November, said that there would be an oxygen shortage. Basically, it said there was a second wave was coming and our health infrastructure would not cope, right? There were independent health experts who said that. There were government health experts. And of course, the example of other countries, right, where there was a second wave. So the question is, why didn't the government pay attention to all of this, to all this overwhelming evidence to suggest what was coming, and the fact that India has chronically underfunded its health infrastructure, and that system wouldn't cope. Instead, of course, what the government did was to talk about this success narrative, right? And you'd remember that both the health minister and the prime minister, indeed, early in the country, just short on the heels of this resurgence, declared that India had effectively beat the pandemic. The pandemic was over. And instead, what the government did was to focus on large gatherings, much to its own interests, right? So election rallies, a huge religious gathering of Hindu devotees, with approximately 9 million people attending. And all of this has created this perfect environment for this virus, helped by new variants, of course, to run wild.
Of course, there have been some heartbreaking scenes which put a spotlight under healthcare infrastructure in India, with people dying outside of hospitals without getting or accessing treatment, a shortage of oxygen. What do we then know prior to COVID-19 about the healthcare infrastructure and access to it in India?
Yeah, it's not good, right? And it's quite similar to what we would see or what we would know in this country. But India is, I think, even more exceptional in contributing a very small percentage of its GDP towards public health. So much of the logic behind at least the lockdowns of last year in countries like India and indeed in South Africa was actually that we needed the time. We needed the time to build up our hospitals, our oxygen supply, and so on and so forth. But now we see none of that. What happened? Well, what happened with that time that apparently we gained? Because what we're seeing, and now it's all over the international press, as you said. It's citizens being literally left to die outside of hospitals. I just wanted to say, and I think I should have reflected on that in response to the previous question, that what I'm doing now is actually working with some volunteers who are both India-based and overseas to help patients and families on the ground to get urgent medical supplies, which is everything from an ICU bed, an oxygen bed, medicines. And it's really extraordinary that this is being done by people like you and me. I mean, we are calling hospitals, and basically, I called maybe 12 hospitals on a Sunday to ask if they have an oxygen bed, and the few that took my call basically said they didn't have anything. And the irony there is that while that's happening and you're getting an immediate sense of the absolute lack of any medical assistance, the government of India was spending a lot of time trying to message to say, actually, there is no oxygen shortage.
Now, Professor, let's bring it a little bit closer to home, because it is concerning for South Africans as well, especially with the fact that travel is loosely still open to and fro India. of course, India is billions of people, so the scale will never be the same in terms of the amount of cases that we have. But we don't want to see a surge in cases in South Africa. We've seen Professor Salim Abdul Karim saying that there's no reason to be concerned, really, as the South African variant contains more mutations. Is this a case where we can, I don't want to say safely say, but at least feel some level of comfort?
No, I think quite the contrary. I think we shouldn't be complacent, but I'll tell you why. I don't think we should panic about the new Indian variant. I mean, indeed, placed in South Africa, we know quite well how these are misnomers, really, to name these variants out of where they originate. In India, what's happening now, and I want to make that really clear, is much less because of a new variant. It's because of this whole all of these factors that I've just pointed out, the lack of preparedness, the poor public messaging and the political manipulation. But none of this is, of course, helped by a new variant, which is highly infectious, right? So that's the first thing. I think South Africans should be aware that it's really not about the new variant as such. It's about all of these factors. But that brings it much closer to home, I think. That should make us sit up and think about, well, if we were to hit by a second wave, are we prepared, right? And I'll tell you what really worries me. I had COVID in December. I guess I got the South African variant. And I was really shocked by the track and trace. When I filled up that form, I put, maybe 2 other adults on the form and 2 children. Nobody contacted them. I was so sort of worried about that I contacted the health department to say, you haven't contacted the 2 adults on my track and trace. And I felt very similarly when I returned from India now at Tampo. Where is the track and trace? How would anyone know if after I got off that plane, I tested positive a few days or even a week later? And we know by now that countries that have been moderately successful in this pandemic have done things like that. I think we always go to the most dramatic kind of form of response, which is either shut the borders or, stop letting in people from other countries. But actually, I feel like we can do much more simpler things to contain. Just the final point, when I exited the airport, coming into the arrivals a bit, most people there, and I presume they're local people, were not masked in an indoor space. So again, I think we can do much more simpler forms of public messaging and public ownership of the pandemic, which is to mask and protect each other.
And Professor, very quickly, before we let you go, let's talk about then, you mentioned the South African variant, and of course then we learned about the India variant. What do we know about the variant in India? Is it faster? Is it resistant to vaccines? How does it work? What information is out there?
Look, I know as much as you know, right? Which is that the research is still happening. None of it is conclusive. What we know inconclusively is that the variant is probably more infectious, but is it more aggressive? Probably not. New research suggests that indeed vaccines and your own natural antibodies do protect you from severe cases of this variant. But again, I think we have to be really clear that it's not about just this one variant. A lot of the research is now suggesting that what we're seeing in India is this mix of all these variants, right? The South African, the UK, which by far as I understand, has been very aggressive, and the Indian. So all of that together is complicating the situation on the ground, and it makes it quite difficult, I think, to focus on one of these. And I think that's why labeling it such doesn't help, because I think it gives the wrong message, that as if this is about one variant from one part of the world and we can contain that. No, we can't. I think as far as I understood, the case of the passenger who came back from India to Durban, it's actually found that he had the South African variant, not the Indian variant. So time and time again, we see how this is a global problem. It's not a national problem.
Very well. Thank you so much for your time. We're going to have to go. Professor of Sociology at Wits University, Professor Srila Roy, giving us a sense of what is happening in India as it faces a second wave.